Welcome to Think Like a Pancreas, the podcast, where our goal is to keep you informed, inspired, and a little entertained on all things diabetes. The information in this program is based on the experience and opinions of the Integrated Diabetes Services clinical team. Given the individualized nature of diabetes care, any changes to your treatment plan should be discussed with your personal healthcare provider. I'm your host, Gary Scheiner, owner and clinical director of Integrated Diabetes Services. Today, we're going to be discussing whether the cure for type 1 eludes us because of a conspiracy in the diabetes industry. I'm very pleased to be joined today by my colleague and friend, the JDRF CEO, Dr. Aaron Kowalski. Aaron, welcome. Tell us a little more about yourself.
Gary, it's a real honor to be on with you. You're a legend, and I appreciate so much you do. So for the audience, I'm Aaron Kowalski. I'm CEO at JDRF. Been at JDRF for almost 19 years now. Grew up as a scientist at the organization. Took on the role of CEO about 4 years ago. I have lived with type 1 since 1984. I was 13 when I was diagnosed, and I also have a younger brother who was diagnosed in 1977. At the age of 3, lives right down the street from me. We're close and doing well, fortunately, both of us, and thrilled to be working on the front line and talking about cures for type 1, which is an exciting topic right now.
Yeah, when I first saw the map behind you, I thought those were major JDRF research sites, but then I found out it's even more important than that. Why don't you tell me
these are my behind me is a map of the United States with my golf ball marks. So I grew up a golfer. My grandfathers both loved to golf, and I took up that as a sport. And it's fun to be able to travel around and talk diabetes on the golf course every once in a while.
Yeah, I mean, I've been lucky enough to have known Aaron since when he first got started with JDRF. I met him at a Philadelphia chapter board meeting, and he always pulls me aside. We talk about all the latest and greatest since we both live with type 1. And he was the guy that convinced me to give the DIY open source systems a try. And there was no turning back after that, Aaron. I set myself up on loop, and I've been doing that ever since. What are you using now?
It's amazing. I was a longtime looper. I'm thrilled that it's that community that has a tight bond. I do Tandem now, Control IQ. It's been great for me. I'm on a G6, hopefully G7 soon. I switched one because the algorithm that sits inside of Tandem we funded, and I wanted to give that a try. Worked with that team a lot. I also had a DIY pump that wasn't completely behaving all the time. But I think it's philosophically for me at JDRF, I'm a big believer that more options for people with diabetes is better. So I love that we have Control IQ, 780G, Omnipod 5, Beta Bionics. Over in Europe, we have the CAM AP system. We have DIY now Type Loop. That's something I'm really passionate about, is getting Loop communicating with some of these companies in the FDA approved version that JDRF and Helmsley funded. So it's great to see, certainly since my brother and I were diagnosed, and you know this well, the incredible benefit of having automated insulin. It's just such a step forward.
Yeah, there've been a lot of baby steps along the way. We don't have that elusive cure yet. And I think everybody hears this at the time of their diagnosis. It'll be about 5 years till there's a cure. I heard it in 1985, and everybody, since then gets the same rhetoric from their physician or their healthcare team. So 5 years ago, I got a photograph of you and I. It's not a real clear image.
I remember that.
Yeah, this was 5 years ago in Orlando. We were at one of the diabetes conferences, and a popular spot there, because it's so hot in the summertime, was the ice bar. And this was a big ice globe or ice sphere, and we both put our hands on it, and we prayed to the diabetes gods for a cure. And we're 5 years out now. I feel like there has been tremendous progress. As you said, we're not quite at that cure yet, but how would you define a cure? Because I hear different definitions associated with it.
So the one thing that you'll hear me say, and I'm very um, uh, definitive about this, is I don't think there is such thing as a cure. I think there will be multiple cures, and I'll explain why I think that's really important. And I think it's kind of like artificial pancreas. When we started that project, people would say, "Oh, we're going to build an artificial pancreas," and I just rattled off. You could define, are these really artificial pancreases? Not really. They're kind of automated insulin delivery systems on the way to trying to replicate what we lost with diabetes. And there are multiple different versions of them, different algorithms, different pumps, whatever. Similarly, I think curing type 1 is going to come in a variety of different ways. To me, like I'm using air quotes, cure is not needing to take insulin, not getting low, not getting high, having a normal A1C, not getting complications, and having little or no interaction with my diabetes.
That's the key. That's a big part of the definition is don't bother me.
Yeah.
Manage my glucose beautifully as if I didn't have diabetes, and I don't want to have to be involved in that. I want to sit back and whatever procedure or system is in place that can do that, that's when I'll be satisfied.
Yeah, and some people will talk about the devices as cures, and I don't see that. I don't think I often joke when I'm speaking that there aren't people don't walk around with insulin pumps who don't have diabetes. I do see people now the whole thing of the sensors, that's people are putting on sensors. I've yet to find somebody putting on an insulin pump. So I don't count insulin pumps as a cure for type 1. I often talk about wanting to take off my diabetes devices. But the reason I think I hedge, like, what is it, is I'm very, very excited right now about cell therapies. And I'll talk a little bit about the history of cures and why is it always 5 years away? And what does that mean to us today in 2023?
Given we've been driving for this for so long, so many years. I've been a JDRF volunteer going on over 30 years now. I used to write for Countdown magazine back in the early 90s. I was the sign man for the walks in the Philly region. I'd be up at 4 a.m. with wooden stakes and a sledgehammer putting up the signs. I looked like I was hunting werewolves or something. I served on the board, and now I present at the Type 1 Nation conferences, and I done the Bike for the Cure. We've been at this for so long, and given there's a lot of money backing this, so I'm just going to ask you point blank, Aaron, is there a conspiracy to keep a cure for type 1 diabetes from coming to market?
No, absolutely not. Nothing could be further from the truth, and I'll explain why. And I often use kind of analogies. And in this case, I'll ask you, when was the last time you were at Blockbuster Video?
Oh, Blockbuster Video? No, it's been a
Some people probably don't even know what Blockbuster Video is anymore. It's been a while.
We used to go to rent movies on VHS, plug them into the VCR and rewind them and play them. Yeah.
Okay, there used to be one on every corner. It's almost as many as a McDonald's probably. Now I think there's one left in the US, and it's a novelty shop in Oregon, is what I'm told. When was the last time you took a picture with a roll of film?
Oh, college.
Yeah.
That was a long time ago.
And I'm using these as examples of the idea and the concept that if you don't innovate, you go out of business. And every company out there would love to cure type 1 because it is a business. And I think that's something that the diabetes community wrestles with a little bit. I come from a family where my dad was a J&J scientist for 35 years, and I really appreciate what the industry does to keep us healthy. I say that as a non-conflicted JDRF person. We don't invest in like any stakes in personally, I can't make money off of the diabetes companies. But what I will say is we need companies to drive innovations forward. And if you don't innovate, somebody else is going to do it. Look at, and I hate to pick on diabetes companies, but being a J&J family growing up, we used LifeScan finger strips forever. forever, tons, gazillions of them, 2 type 1s. Where's LifeScan now?
They're an independent company. They were sold off from J&J.
But most people don't use LifeScan because CGM obviated the need for the bulk of finger stripping in the cutting edge of diabetes management. And I think what's going to happen is curing type 1 will eliminate pumps and sensors, and that is a business. So for me, it's a matter of Vertex, and it's very specific now. You can give, Vertex is trying to do stem cell derived islets. They've invested over $2 billion to do this. They are building a plant to manufacture cells. So that, which is in the first patients in their clinical trials are coming off insulin. I think they meet every definition of what we described as a curative therapy. This first guy, he's out in the news, Brian Shelton, mailman, lost his job due to hypo problems, has been off insulin for 2 years now. So to me, it's not a matter of like there's a conspiracy. Everybody, all these companies are trying to develop better therapies that they can provide, which we will pay for. But that's how it works. JDRF's not going to manufacture this stuff. You're in the Philly area, UPenn's not going to manufacture this stuff. I'm in New Jersey, Rutgers isn't going to do it. Harvard's not going to do it. You need companies. It's the natural evolution from research to industry to people. And that's a business. So for JDRF, we I think have come a long way in understanding that. And if you'll indulge me for just 2 more minutes, why have we always been promised a cure, and what was the holdup? We were promised a cure because cures have been around for over 20 years. If you talk to anybody who's received an islet transplant, they will tell you they're cured. Now, you can debate that they do need immunosuppression, but if you talk to them, they'll say, I don't have diabetes anymore. So imagine going to a JDRF board meeting, meeting somebody who has type 1, they're getting low at the dinner table, and then the next meeting, they're off their insulin. How could you not think that that's close? And there are people out there. We estimate there have been about 5,000 islet transplants. They last for about 10 years, the islets function on average. I was with James Shapiro, who's the Edmonton protocol guy. He has patients now 20 years off insulin. So these people consider themselves cured. The fundamental flaw, and what really messed us up, was not appreciating that you needed a business model, that you needed scalability. You needed to be able to manufacture these. You needed to go through the FDA. And I think the fact now that we have companies like Vertex, Novo Nordisk, Eli Lilly going after cell therapies shows you it's not a conspiracy. It's about the science and the ability to do it. And the science and the ability to do it are here.
Well, speaking of the science,
yeah.
I mean, you have your finger on the pulse of research in your position at JDRF. What do you see as some of the more promising projects that are along the pipeline now towards finding a cure?
Well, Gary, you showed that crystal ball, and I often say to people, so they're like, so what's going to happen? How's this going to play out? And I'll say, here's my crystal ball of how I think this is going to play out. I think you're going to have the first cell therapies coming to the market in like 26 or 27. So it's not, I'm not going to give 5 years, because 5 years is always 5 years from tomorrow. I think this is a 3 to 4 year horizon, could even be shorter, for an immunosuppressed stem cell derived islet product. So for the non-scientists out there, what we're talking about is growing up insulin producing clusters of cells, islets that are in your pancreas. Now they're insulin producing, but they're also glucagon producing and amylin producing and somatostatin. These are clusters of alpha and beta and gamma cells. So you can grow these up now instead of requiring somebody to die and donate their pancreas. And that's a big fundamental shift from what we would call cadaveric islet transplantation to now stem cell derived islet transplantation. Vertex, the first trial that they're doing, some of you who are listening probably have heard it's called VX880. You have to have severe hypoglycemia problems to get into this trial. But the first people are coming off insulin. And the way it works is you get an infusion of cells, they settle in your liver. It's just like an islet transplant. And you go on immunosuppressants. Vertex has said publicly they're going to bring this to the market. So that's why I say cures, because if I had a 12-year-old with type 1, and knock on wood, thank goodness I don't, but if I did, that would not be a great therapy for them. Interestingly, for somebody like me who's in their 50s with type 1, it's something to consider. Certainly for people, I think they're going to go after kind of two markets here: severe hypo people and people who are already on immunosuppressants because they lost their kidneys due to type 1. And we estimate there are about 10,000 people out there in that boat. So that's like stage one. I think that's super exciting. I mean, if you get that first cell therapy product out there and it's taking away the need for insulin for years, that is a major, major step in our opinion. So JDRF, we're doing a lot of work now on kind of the regulatory pathway, the clinical trials pathways. There's a whole lot of interest here. To your question about what's exciting, well, of course, what we want to do is do this without immunosuppressants. So it's available to anybody, adults, kids, whoever. That is a massive area of focus. We will invest, JDRF alone, upwards of $100 million in the next 2 years to work on these potential solutions. Almost everybody's heard of encapsulation. Vertex has launched a trial called VX264 with an encapsulated version of their cells, no immunosuppression, which is really interesting. And a bunch of JDRFers are trying to get into this trial. We have huge projects on gene editing the cells. So I call this the Harry Potter cloak of invisibility. You inject those cells, but they aren't recognized as bad by your immune system. And a variety of other approaches on the kind of immunotherapy side of the equation. So I could go on and on. You can kind of point me wherever you want me to go, but
yeah, the immunotherapy part to me is the crux of this, because I think most people with type 1, not all, but most are at a point where hopefully they're using some kind of an automated insulin delivery apparatus. Blood sugar control is getting better. We're not having to work quite as diligently to accomplish that. So to go from that to a cell transplant where we would be required to take immunosuppressive drugs, to me, isn't a great leap forward. The immunosuppressive drugs that are being used today have a lot of side effects. They can really compromise a person's quality of life. What do you say about that?
Yeah, so this is interesting. I would have been in your camp a year or two ago. And I'm in a little bit of a different camp. The goal, and again, for JDRF, this is our kind of a number one priority, is immunosuppression-free cell therapies. So again, we're going to invest as many dollars as possible to make that happen as quickly as possible. That said, I was up at Vertex, and I'm highlighting Vertex, but this could be any of the cell therapy companies, just because Vertex is in the human trials already. And they said to me, would you do it? Would you trade your diabetes for immunosuppression? And I said, I don't know. I got to think about that. I went home and I said to my wife, you know what? I might do it. And she said, you don't want immunosuppression. And I said, I don't want type 1. It's kind of a drag. Mm-hmm. And even with the devices and with the better control, it's still a drag. It's still hard. It's still frustrating. So I'll give you some interesting anecdotes with some data. JDRF, we had an event in Toronto last month. We brought a bunch of volunteers and supporters together with a bunch of scientists. One of the scientists was from Edmonton. His name is Peter Sr., Dr. Peter Sr. He's an endocrinologist. But he works on that team that does the Edmonton protocol and transplants islets into people. And I said to him, Peter, can you tell the audience what are the downsides of immunosuppression? And how many people quit? And I think this is really interesting because whenever I meet people, and I've been fortunate to meet a number of people who've had either islet transplants or whole pancreas transplants, is they don't go back. And that's like telling to me. So, because again, for the audience, if the immunosuppression's so bad for you that you can't tolerate it, you can stop taking it. What's going to happen is you're not going to like nothing bad is going to happen to you. You're just going to go back and have type 1 again. So he said, if you're on these immunosuppressants, which by the way, for the cell therapies are about half of what a solid organ dose is, you have to get your skin checked yearly. You can have skin cancer issues, risk. You have higher risk of infection. You have in the first month, usually fever, nausea from getting the diarrhea, getting the dose right. That usually goes away. And they've seen in Edmonton 2 cases of blood cancers that they think were due to the immunosuppressants that weren't fatal, but they think were due to the immunosuppressants. Okay, so then here's the punchline. That's like the what it takes. So what happens when people with diabetes do this? So he told us that he's been involved with 328 islet transplants. 2 people have quit, and they both quit in the first week. Now, it's 328. There are 1.4 million Americans with type 1, so it's just a tiny group of people. And these are people who are selected who have big problems with hypoglycemia. But the bulk of people, almost every single one, sticks with it because the immunosuppression in their mind is less burdensome than the diabetes. And I think that's really, really telling. There's another guy that sits on our research committee of JDRF, and he has a whole pancreas transplant. Really smart guy. And he always says to me, I can't believe you guys still do diabetes. It's just so much easier to do what I do. And again, that's an anecdote. But what it does for me at JDRF and from a policy, because I used to run our policy group, and is I now, when we talk to the FDA, I am of the ilk that we should be pushing for that VX880 and the subsequent first gen products to be available to as many people who want them. I think you should be able to make that decision. I don't think you should need to show that you nearly died from hypoglycemia. I think as an adult with diabetes, you can line up the risks. Here are my risks of diabetes, by the way: kidney failure, eye disease, heart disease, all these things that are percolating, unfortunately, in our backgrounds. Here's the risk of immunosuppression. And I say this again, I've got to stress that this isn't the end game. But I think if we could put that stake in the ground and show we can take away insulin for years at a time, and now let's make a world-class effort at getting those immunosuppressants taken away, that's a huge, huge step forward.
Now, 99% success or continuation rate is phenomenal. In my mind, do you think that has more to do with the immunosuppressants not having as severe an effect as we think they do? Or do you think it has more to do with how much of a pain in the ass it still is to live with type 1 diabetes?
I think it's both. I think if the immunosuppressants were so bad, I think people would go right back. And, in islet transplant, the selection criteria is pretty high. Like, you got to go on your devices and work. So I tend to think that, and you talked about it, Gary, just a second ago. You said, you have the glucose side, but you also have, I don't need to think about this. And one thing that I'm constantly trying to impart to key decision makers, whether it's FDA, NIH, Congress, is you and I, type 1 people, look like everybody else, but nobody appreciates the grind. And it's hard to quantify that. We've struggled to quantify it in clinical trials, in PROs, patient-reported outcomes for FDA, but we know it. We know it. The stats bear it out. The bulk of people aren't doing really well. We know that from the T1D exchange. So I think it's just diabetes still. And it's really hard. So, this is why I'm so driven to take off my pump. Like, that's my goal as CEO. I want to take off my pump and then I'll go do something else. So I think it's really, really telling that these people don't go back. And we should learn from them.
Yeah, even with the innovation, the technology we have now, things are better. They're
Yeah.
getting a little easier, a little better, but we're still a long way from.
Yeah. Normalizing blood sugar, making life easier.
Now, along that line of thought, I was excited a few years back when I heard about a company like Beta Bionics working on a dual hormone system. So I've always felt that if you have a pump that delivers insulin but not glucagon, it's like driving a car with a gas pedal and no brakes. Eventually, you're going to crash. And now that we have glucagon available, and there's research involving co-formulating insulin and amylin to simulate more normal digestive rates, do you think we may come to the point of what I call a mechanical cure, where we have a pump type system with multiple hormone capability that can regulate glucose without us intervening at all, not having to announce meals, not having to worry about going low with exercise or high with stress and illness? You think we're going to get to that point?
I think it's the things that we're talking about here, whether it's amylin, glucagon, we're very interested in these GLPs, the Ozempics and of the world. Adding things that make our bodies more physiologic, like before we had diabetes, makes a lot of sense. I think the challenge is a couple fold. One is just the science, as we all know, and you've written about this extensively. Insulin's not meant to go through your skin, and it takes a long time to absorb, and it's not physiologic. So you have these barriers that it's not how the body intended you to do it, and you're trying to kind of like shoehorn it in like a better way. The other one that's a challenge is the economics of it. When you look at justifying adding these additional hormones, you often have to make a case to payers, and you've got to show like the additional benefit, less lows, less severe lows. All of that said, we're still funding a lot in this area: dual hormone, co-formulated, liver-targeted insulins, GLP-1s. I personally love the idea of the GLPs because, and the SGLT inhibitors, if we can get around the DKA risk. But the beauty of those drugs are these additional benefits on the complication side that seem to be really powerful. Reduced progression to kidney disease and heart disease. Yeah, I was just with some of the Lilly and Novo and Sanofi people in Boston a couple of weeks ago, and we also even have like kind of the holy grail of all treatments to me is a glucose responsive insulin. Imagine if you had an insulin that only worked when your body needed it. And we've been talking about that at JDRF for like 10 years now, but both Novo and very active programs in this and are moving them into human trials. So if you could get all of that without the device, that would be pretty sweet. So I think, until there are cures, philosophically, for us at JDRF, I always say the North Star, you're in Philly, Lee Ducat, the founder, one of the co-founders at JDRF, was curing type 1. That's like the North Star. But you've got to be healthy when we get there. So having a mechanical, as close to you can get, even if it's a biochemical or true mechanical solution, we're still not giving up on, even with all like the sub-Q challenges and stuff like that.
Even if the pharma device industry, even if they're not suppressing a cure or the research towards a cure, I feel like they could be dedicating more resources towards it. And I think a lot of our listeners and our clients feel the same way. What can the average person and their family do to encourage greater investment and faster and better results in the research that's taking place?
Well, this will sound self-serving, but support the research. We fund a lot of research. JDRF, this year, our budget will be $100 million, and the bulk of that, probably 75% of that, is going towards curing T1D. But it's not enough. Got to do more. So part of that is just helping us fund more research. Part of it is every single listener should be an advocate. You may have seen, I was on Capitol Hill last week. I spoke in front of the Senate Help Committee, which it was focused on diabetes type 1 and type 2. We advocate for what's called the Special Diabetes Program. It's $170 million a year to type 1 specific research. If you wear an Omnipod 5, a Tandem, a Medtronic, a lot of the trials that got those devices approved were funded by this program. If you have heard of teplizumab, this new drug that delays type 1 diabetes, that was funded by Special Diabetes Program, their pivotal trial. So advocating is hugely, hugely important. And anybody can go to the JDRF website and sign up to be an advocate. You should do that. It's the world's easiest job. Like, you're just bothering your congressperson in a good way to support diabetes. The other thing that we're very focused on right now is clinical trial participation. So when I started at JDRF, we were funding like 2 clinical trials. Right now, we're funding 80. And the bulk of them don't get answers fast enough because they're hard to recruit for. So we have a site. You can go on our website and literally type in, I'm Aaron, I live in New Jersey, I'm 51 years old, I think, so 2. And this is what, my diabetes looks like. And it'll give me the trials I can participate in. It moves these things faster. So please, I urge readers, your doctors often don't tell you about this. You can do it. You can search it. You get amazing care. You get access to cutting edge research, participate in clinical trials. So to me, it's, you can fundraise, you can have a huge voice, and you can participate in the research itself.
We helped recruit for the teplizumab trials, and everybody who went through it was really happy they did. Whether they were a control subject or received the medication, it's such a valuable thing to be able to do for the diabetes community.
And Gary, just to digress for 1 second, back to immunosuppression and cell therapy. So I was with Kevin Harold, and if your listeners don't know who he is, he's this amazing researcher at Yale who was one of the original scientists who discovered teplizumab's role in delaying type 1. And he has type 1 himself. He lives with it. And I was with him 2 weeks ago, and we were talking about this idea of immunosuppression versus immunosuppression-free. And he goes, imagine if we did teplizumab at a transplant, and you just had a 2-week immunosuppression, and then went for 5+ years. So, this idea of cures is it's going to happen in stages, is we're already moving towards what are the next things that would be very targeted, lower side effect profiles. Teplizumab may be one of them. And you're recruiting that trial, helped get that drug approved, delays the disease, and may have other applications for people like us who need beta cell function back as well.
Yeah, you sure do. So do you have a take-home message for the conspiracy theorists that say, don't even bother getting involved, it's never going to happen?
No, it's not a matter of if, it's only a matter of when. I am certain we will take off our pumps. I won't say 5 years, but my goal is to do it while I'm here at JDRF. And the way to do it is to get the research done. This is a research problem. We are approaching solutions. I mean, if we went back 10 years ago, we would have said, it can't be done. You can't make a stem cell make insulin. It's done. It's happening. So these steps are about funding research, getting the companies, this market, and by the way, this could help insulin-dependent type 2 people as well. There's a big opportunity to help a lot of people, and that's what the companies do. They develop therapies, they help them, get them out there, and it's a business model. That's fine, because the win there is we'll be able to take away our diabetes. So I don't see it as a conspiracy theory. I think the issue for us is diabetes is underfunded. We're trying to fund it. We need more. We need more government funding. For listeners outside the US, we are working on this in Canada, Europe, Australia, always trying to push people to fund more of this work, because if we do, we'll get there sooner.
Nice. You mentioned before something that I've always also said when I go and present at conferences is when we get to the cure, we want to be in as good a shape as possible. We want to be complication-free, healthy, to be able to enjoy the cure when it happens. And that, for the most part, it comes from good self-management training and skills and staying on top of things. But I like to always ask, what are you going to do the day you're cured? And mine, I'll ask you yours in a second, but mine, I'm going to go for like an all-day bike ride. I'm going to show you something. After that bike ride, I've been saving a box of cereal that I bought a long time ago, Homer's Cinnamon Donut cereal. The expiration date on this is 2002, but I'm eating it anyway. And I always thought it'd be ironic if I survive 40, however many years with type 1 diabetes unscathed, and then this cereal kills me. What are you going to do the day of the cure?
I love that. Everybody wants to like eat something crazy. I just want to just go out. I like to run, go for a run, not worry about it, and just think about diabetes being in the rearview mirror.
Nice.
I love the idea of just thinking about, we used to do that. We've had some of these. We used to do that, some diabetes that feel really good. Like I used to poke my finger a million times a day. I don't do that anymore. I would love to be able to, I can't wait to be able to say I used to wear a pump. And that, like, of course, I would love to have some Honey Nut Cheerios and like, a big Frappuccino or something, but the more satisfying piece.
You want to come over? I'll share my Homer.
Yeah, some Homer Simpson cereal. I love that.
Well, Aaron, I can't thank you enough for joining us today. As a reminder, Integrated Diabetes Services is available worldwide. We assist people of all ages with their glucose management, self-management education, and just how to make optimal use of all the latest tools and technologies. We have specialized services in both English and Spanish for athletes, people who like to exercise, anyone trying to lose weight, have a successful pregnancy, or who just need emotional support. And you can get more information about our practice at integrateddiabetes.com, or you can email us at info@integrateddiabetes.com. So on behalf of Think Like a Pancreas, the podcast, thank you again, Dr. Kowalski, CEO of JDRF. I'm Gary Scheiner. Have a great rest of the week.